good evening. I'm Audrey Wiggins, and welcome to another webisode of Make Something Happen. I'm here with my friend Yvonka Hall from the City of Cleveland, Department of Minority Health. And she's going to be sharing with us today some activities that are coming up. And also, this is Teen Awareness Month as well as Heart Month. So she's going to be sharing with us, and I look forward to hearing what you have to say. Yvonka, want to give us a little background about yourself and then lead from there?
Sure. My name is Yvonka Hall. I'm the Director of the Cleveland Office of Minority Health. I've been doing this work about 17 years.
Wow.
But in 2008, the state of Ohio decided that they wanted to do a local extension to their statewide efforts.
Okay.
And they created 6 local offices here in the state of Ohio. We are the only state that has local offices of minority health.
Okay.
We have them in Akron, Youngstown, Dayton, Toledo, and Columbus. And Cleveland all have local offices of minority health. So we have a unique situation. We are the eyes and the ears from a local perspective. So we give an opportunity to get the word out in the community about things that impact our communities disproportionately locally.
Okay. All right. And what are some of the activities that you do on a regular basis?
Well, our offices were created to inform, educate, and empower the community on health disparities and health equity issues. We focus on mobilizing community partnerships, monitoring health status, developing policies and plans, and just basically working with the community to get the word out about things that impact us more so than anything else.
Okay, and then what happens when there is an emergency? Your office is the office that takes care of that as well. You don't have to go into details, just asking, does it flow through you?
We don't take care of emergencies. We do have an Office of Emergency Preparedness that handles that.
Okay.
But one of the things that our office does is we're a connector. Because of one of our focuses is to mobilize community partnerships.
Okay.
We've been able to help the Cleveland Department of Public Health actually meet with community partners and better engage them.
Okay.
So that gives us a unique perspective because we work with the Hispanic, Latino, the African American, Black populations, the Asian and Pacific Islander, and Native American populations that are here in Cleveland.
All right, awesome. So any minority group would flow through that process through the Department of Minority Health.
Or communities are disproportionately impacted by the burden of disease, death, and disability.
Okay. All right, that's awesome. Well, we mentioned Heart Month, Teen Violence Awareness Month. So those are a couple of things going on. And also in April is set aside for Minority Health Month. So I know that's a big thing that's going to be coming up, and your office is probably scouring and preparing for all types of activities. But leading up to that, let's enlighten us a little bit, about the American Heart Month, the teen violence, and also I know you have an event for sickle cell anemia. Okay.
Well, Heart Month. One of the things that's important for us to understand is that minorities, particularly African Americans, are disproportionately impacted by heart disease and stroke. African American women actually have a larger amount of heart attacks than anyone else. Now, African American men, although African American men actually have more strokes than African American women are more likely to die as a direct result of those strokes.
And why is that, Yvonka?
Well, part of it is because of our nutritional habits, the obesity epidemic, diabetes, heart disease, all of those things that disproportionately impact our communities.
Okay.
When we're talking about smoking, especially with strokes, we're talking about smoking, obesity, diet, all of those things play, and hereditary.
Oh, yes.
Do we have genetic factors that impact us more so than others? And when we're talking about heart health, because our community seems to be a lot more stressed, those stressors play a factor in how we're able to bounce back from different things that may impact us disproportionately.
Yes. Okay. All right. And so, what kind of activities the American Heart Association, I'm sure, are putting on different events to raise awareness this month? What can we do as individuals to support this effort?
What I would say definitely is check the American Heart Association's website.
Okay.
Make sure that you go to heart.org, AmericanHeart.org, and check out some of the things they have. They actually have some nutrition guidelines. They have some recipes.
Right.
They have some activities that they're doing, like their Go Red for Women activities. They have activities that focus on minority communities, like their Power to End Stroke piece. So they definitely have an outreach into the community, and it's important for us to make sure that we support those efforts.
Okay, so make sure, ladies and gentlemen, that you do check out that website, AmericanHeart.org. So take care of that. And so again, tell us more then, leading in, and tell us about the teen violence awareness.
Well, a few years ago, they created an awareness month around teen violence. We do know that we've seen a high prevalence of teen domestic violence, teen gun violence. You know, a lot of those issues that plague our communities. Cleveland has their share. You know, we've seen other major cities like Chicago who have, you know, a lot more cases than we have. But one of the things that's important for us to understand is that things happen to our teens that may not happen to other folks, and that we have to have services that are available to reach out to our teens.
Okay.
So we have different support programs that talk to teens about violence, that talk to teens about self-esteem and self-awareness. They have them at the Y. The NAACP has youth programs, Golden Cyphers, UMADOP, which is the Urban Minority Alcohol and Drug Abuse Outreach Project.
Okay.
They actually have programs that target teens. So we do have these programs that are available in the community to reach out to our teens. And I think it's one of the things that's important for us is that we reach those services and get them to our teens, to those who are most at need.
Right.
We also have the United Way produces a teen booklet, a teen guide.
Okay.
And you can always call 211 for the United Way teen guide and tell them that you would want a teen guide sent to your house. Those things are very helpful because they allow parents to find out some of the things that are available. I, as the mother of a teenage son, know how difficult it can be to try to steer your child away from some of the things that are going on within the communities.
Yes.
Not only, you know, some of the gang activities, some of the violence activities. You know, my son just recently lost one of his good friends. Okay. And, you know, being able to talk to him about grief and grieving and for him to understand that whole process and how it impacts him and what's the impact on him that's different from me.
Right.
You know, because, you know, I haven't been a teen in a long time. Me either. So being able to engage them on that level and actually let them know that they do have a grieving process that's quite unique.
Okay. Yes. So again, they can call 211 and they can get that booklet. How else can they reach out or find help?
They can actually call my office. You know, they can call my office at any time and ask about programs, and I can direct them to those programs. My office number is 216-664-3052, and I can direct parents or children to whatever programs that they're trying to search out.
Okay, and what website would they use?
They can actually look at clevelandhealth.org.
Okay, clevelandhealth.org, and we'll make sure we get that down at the bottom of your screen so you can look that up as well. Okay, awesome. Anything else you want to add to that piece?
Not to the violence piece, but I do have a program that's coming up in February. As City Council looks to honor Black History Month and then talk about some of the illnesses that are going on in our community. City Council has decided that we're going to do a focus on sickle cell anemia. Okay, great. And it's going to take place at the City Hall Rotunda on February the 27th from 11 a.m. to 1:30 p.m. It'll start off with a resource fair with the sickle cell support groups and programs that we have within the community. We have actually the oldest sickle cell anemia association in the United States here in Cleveland, which is the American Sickle Cell Anemia Association. It was established in 1971. That's important.
Yes, that is. That's very important. That's part of our history. That's awesome to know that.
And especially when we talk about something that disproportionately impacts people of color.
Yes.
When we look at sickle cell anemia, we look at about 1 in 500 African Americans actually have sickle cell.
Wow.
And 1 in 12, well, 1 in 500 has sickle cell disease, and 1 in 12 has the trait.
Wow.
So when we're talking about our population in Cleveland, we're looking at about 400 African Americans here in Cleveland that actually have the disease, and about 17,000 that have the trait.
Wow.
So when we're talking about the numbers, one of the things that's important when I go back to teens is for us to talk to our teens. If we think that they have the trait or we know that they have the trait, to talk to them about the trait. Because if they meet with someone else who also has a trait and they have a child, then that child can have the disease. And that's important for us to teach our children, you know, because we do have, you know, a large amount of teens who are our mothers.
That's right.
So it's not for me to say, you know, I would definitely say, you know, abstinence is the best policy.
Absolutely.
But when we're talking about teen health, that it's important for us as parents to make sure they know what sickle cell is and how it can impact them.
Absolutely. There's more dangerous things out here than just your regular STDs. Absolutely.
And you know, especially for for children who are born with sickle cell and have to live with it. Years ago, people died real young when they had sickle cell, and now they live a lot longer. But some of the other issues that they have
affect their quality of life.
So their quality of life is definitely impacted by the disease.
Okay, so give us a little more information about the event and how we can get more information about it, website or that type of thing.
Well, they can contact my office again.
Okay.
They can contact me to register at 216-664-3052. You can call, just leave your first and last name. Let me know that you want to register to attend. I will actually sign you up to attend.
Okay.
And we're expecting probably about 100 folks to come.
All right.
And we're going to provide free lunch.
Okay.
So for all our attendees that day, they're going to have an opportunity to have some information because it's a health and resource fair.
Yeah.
So they're going to get this health and resource information. And then they're going to also get an opportunity to see our sickle cell anemia programs and our sickle cell anemia support groups be honored. Because we're going to honor them for their work that they're doing, recognize them for their work that they're doing in the community.
That's great. Now, will there be any medical staff or medical services where they could test for that? I don't know how sickle cell is tested for. Will that be available on site as well?
Yes, the American Sickle Cell Anemia Association will actually come out and do the blood test. Okay, so it's a
test.
Quick prick.
Okay.
And then they take the blood back to the lab, and then they'll contact you.
Okay.
But those services will be available. And then also all the hospitals that actually have sickle cell support groups and sickle cell programs.
Okay.
The Metro Health, University Hospitals, which has adult and child sickle cell support programs, and medical staff there. And Cleveland Clinic will also be in attendance.
Awesome.
So that's important because we'll have all of those services that people need when we're talking about sickle cell and how it impacts the community.
Okay, that's very informative. We're going to take a break and we'll be right back with more from Yvonka Hall with the City of Cleveland, Department of Minority Health. We're back with Yvonka Hall from City of Cleveland, Department of Minority Health. We left off, we were talking about your sickle cell anemia event coming up. There's some great information there, so we want to remind our viewers to check the website out or give our office a call. We have the information there for you, so you can get more information. And please do sign up for that, as well as take part in any events for American Heart Association for American Heart Month. And if you have teens out there, teens watching, make sure you plug in and get more information for our Teen Violence Month as well. All right, thank you. So Yvonka, what else is going on with the Department of Minority Health? You've got some other stuff coming up.
Well, we stay quite busy. I have an advisory group that you're part of that actually meets the third Friday of every month at 9 o'clock when we meet at the American Cancer Society. So if we have people who would like to be part of our advisory group, you're more than welcome to come out to our meetings to be part of this, because I think that it's important for us to have the community involvement and engagement.
Absolutely.
Because then we get the perspective of more than people who are working in the field. We get people who are actually on the ground seeing those things that are happening day to day.
Yes, your grassroots folks. Yes, that's very key. Almost like the engineers that make the bus seats, but then when we get on the bus, we come out with the neck ache and all of that because they never sat in the seats. Very important to have those that first line of defense, so to speak, there. Okay, and then you have what is it, Minority Health Month coming up in April. I'm always excited about that. You always have this big calendar with all of these different events on it, all across, not just the county, but Lorain County. I've seen different events going on. Well, you have this big smile on your face.
So do you see the twinkle in my eye?
Yes.
Minority Health Month is a biggie for us. For one, because it is now a national holiday.
That's awesome.
You know, it's a national observance.
Mm-hmm.
It's a 30-day high visibility campaign focused on health and wellness that started here in Ohio. And so it went from here and it became national. And so we have to give ourselves kudos for that because when all of these other states are celebrating Minority Health Month, we started it here. For us here in Cleveland, we actually do it bigger than everybody else. We do about 150 agencies do something for Minority Health Month.
Wow, that's a lot.
So even though those agencies aren't being funded by the state, we fund about, I think here this year we have about 20. The other ones still do something because we look at it as being that important that even though we're not being funded, it's important for us to do something during Minority Health Month.
So they're really committed to their missions, and that's awesome.
And so for my office, you know, we're responsible for our kickoff. So my office focuses on Cleveland, Greater Cleveland, Lorain, and Elyria. So that's my territory. And now I have a little bit of territory that's in Geauga. And so what we do is we have a Minority Health Month kickoff. And last year we did it at the Cleveland Brown Stadium. And this year we're looking to do it at Camp Forbes. So we'll let you know, you know exactly where it's going to be at.
Does that happen in April or does that happen in March?
We're gonna kick it off in March. So it's gonna kick off on March the 31st. And one of the things that we're going to do different this year that we've never, and I'm excited, that we've never done before is we're actually going to do a Zumba fitness.
Oh, wow. The younger sister's all in the Zumba. I've got to get started.
So we're going to do a flash Zumba fitness session. Where you have 10 Zumba instructors that have volunteered their time.
Oh, wow.
We hope to have about 300-400 people, hopefully 500 to 1,000 people.
We got to get there.
That come out and actually participate in this mass Zumba fitness session.
Oh, my goodness. Oh, that sounds exciting. When you dress, you have to dress like loose clothing or something.
Oh, yeah, we want you to, no heels, ladies. The makeup can stay at home. Gentlemen, we want you to come out. We want you to have a good time. Because we want to spearhead or jumpstart you into fitness.
Tell us, I'll cut you off there for a second. Tell us more about the Zumba. Some of us haven't been there. We've heard about this Zumba thing, like we go to boot camp, but Zumba, tell us more. What actually happens in that type of activity?
Zumba is a Latin-inspired, Latin-infused dance that actually is a high-energy physical fitness session. So you actually lose more calories doing Zumba sessions than regular exercise. Because you're constantly on the move and you're working all of the muscles in your body. So when you get finished with Zumba, you have actually worked it, So, that's one of the things. And, a few years ago, we did a mass Zumba thing at one of the Tom Joyner's Up All Nights. We did one downtown. So we had a few hundred people that were there. But we really, we want to make this the biggest. So we want people to know that as minorities, we're committed to health. That we may not always practice all the things that we need to do. But that we are, interested in the health of not only ourselves, but our children too. So this is a family event. So we're telling folks, bring your kids, bring your husbands. Don't just think the husbands are going to stand on the sideline and watch the ladies work, or the guys are going to watch us work. We're going to all work this together, and hopefully as a community, we can look at this and say, what can we do to not only make my household healthy, my community healthy. And I think that's, one of the things that, we as minorities have to do. We have to look at the places where we live, work, learn, and play. Because those are the things that impact our health. So when my office is talking about how do we educate, inform, empower, we're talking about those social determinants, education, employment, and housing. So all of those things play a big part in it. So for us to make sure that we start somewhere to get to where we need to go. And if I can start this Minority Health Month off with this Zumba-thon to get people going and get people moving. And then the next day, which is that Sunday, which is actually Palm Sunday, but it's the first Sunday of April.
All right.
We're asking the churches and faith-based institutions to actually we have a folder that we created, and they're gonna get a folder, and they can use that folder throughout the year to focus on different illnesses that are going on in the community. So I think this is a great opportunity that this Minority Health Month we've done something that we haven't done before. That we have allowed ourselves and our programs to branch out into all sectors of the community. So
that's exciting. I can't wait till that kickoff comes and to actually take part. We're going to have you back so we can before that kickoff, so we can really pump that up again and get some people more involved in what's going on.
Yeah, maybe I'll bring some of the Zumba instructors back with me.
Oh, that would be fun. Yeah. So we get our little Zumba on.
So they can see what they would miss if they don't come.
Yeah, absolutely. Yeah, I think that's an awesome idea. That's great. Yeah, so we're gonna look. So we've got some Zumba coming up for you next month, end of the month here, promoting Minority Health Month in April. We're gonna take a quick break. All right, we're back now with Yvonka Hall from the City of Cleveland, Department of Minority Health. We left off talking about Zumba and the events coming up for Minority Health Month. What other types of events or programs can we expect?
Wow, I do know that in April, on April the 24th, we're going to also do an advanced grant writing workshop.
Okay.
Last year we did a basic 101. And we had all these people that came. And when they came, they said, we need a little more. We need a little more.
Okay.
And I said, well, we got to start somewhere. So we're going to start with 101. Then we'll go into the 202 session.
Exactly.
So we're going to do an advanced grant writing workshop. And hopefully we'll have about 200 people that actually come out and attend. We're going to do it at the brand new Warrensville Heights Library when they open.
That's great.
So they have a large room, I guess, that'll accommodate about 400. So we're going to be accommodated there, and we're going to have a nice session. Okay. And it's right there in the community. It's close by the highway. Yes. It's close by bus transportation, so people will be able to get there. Okay. So we've done those. We've done some building capacity workshops. In May, we actually have one for women, for African American women, and it's in regards to the Affordability Care Act, the Affordable Care Act. So.
Give us, before you go any further, what is that about? Give us more information on
the Affordable Care Act is actually the health program that the Obama administration has implemented. Okay. And so basically what we did was we wrote a grant to just talk about the Affordable Care Act from the viewpoint of African American women, about the screenings. Because a lot of times what happens is because we're so busy with our families, we neglect some of our things that we need, like our screenings, the mammograms, and neglecting to go get pelvic exams and some of the other things that we need. So this will be our opportunity to talk to women and say, these are the screenings that we need. This is when we need to start having these screenings. Okay. These are the screenings that we need to have throughout the year. We'll have a cultural competency piece there. We'll have a nutrition piece there, the Affordable Care Act 101, So those pieces are important to us and important to the office.
Yes.
Because when we're talking about minority health, unless we actually talk to the people who are being impacted, they will never know what their circumstances are. And so that gives our office a better viewpoint of it than anybody else.
Yes, absolutely. Okay, sounds like you have some exciting things coming up. I hate to have you make a list of agencies without a piece of paper in front of you, but can you have some more of the agencies that'll be participating?
Wow, we have lots of agencies that participate. Actually, the Congresswoman Marsha Fudge, her office participates. U.S. Senator Sherrod Brown, his office participates in our advisory committee. UCAN Ohio, Councilwoman Joy Jordan, and the National Council of Negro Women, the Coalition of 100 Black Women, the Cleveland Department of Public Health Office of Emergency Preparedness. They participate on my advisory committee. A lot of the other community programs. Kincaid Kindred Spirits participates on the advisory committee. I mean, we just have so many folks that participate on our advisory committee. And what not only participate, Asia Inc., Proyecto Luz, which is the Hispanic Communities Program, they participate on our advisory committee, and I in turn participate on theirs.
Awesome.
So we have all of these pieces that come together to look at, how we can impact health. The Minority Health Alliance, and then just private folks who say, you know what, I have a hand in this, and I want to help out any way I can. We have a car seat program at university hospitals that actually participates on our advisory committee. So one of the things that we get an opportunity to do is, WellCare, some of the health insurance agencies participate. So what we get a chance to do with our office is, because we are all working together, when they have activities, I'm able to promote their things. When I'm doing things, they're able to promote mine. And then we figure out niches where we can collaborate on different things. And we've had lots of collaborations and done some things together to help out the community. Because I think that's part of it. Part of it is, a big part of it is for me not to just have this information, for me to make sure that we're sharing it with the people who are at risk. And so for me,
actively sharing, not just saying, okay, the office is here, come get it. Right.
Definitely. And I think it's so important because we help people know what services are available to them. And that's the biggest part of doing anything when you're talking about working with the community.
Absolutely.
If the community doesn't know that you exist or that programs are out here that can actually help them in whatever they're going through, then what's the purpose?
Absolutely. One thing you didn't mention, mental health. And that's a very, we need awareness of that, especially in the African American community, that piece. So what organizations or organization you have participating in that?
We have NAMI, and we also have ADAMS, the ADAMS Board, the Alcohol and Drug Abuse and Mental Health Services Board. So, ADAMS. And then we also, we were getting ready to work on a mental health across the lifespan piece. And what happened was Case sent me an email and said, you know what, we're going to do this mental health piece. And I was like, you know what, we were getting ready to do the same thing. So we're going to collaborate with them on their piece. So as soon as we know about some dates and some dates and times and places, we'll come back and we'll let you know.
Okay, that's great.
But that's a biggie.
Yeah, I'm sure it is. In collaboration, we have the resources of both entities together. You can do so much more. Definitely so much more. And I'm learning that even in business, more organizations and individuals are coming together to work on projects, to see what they can do in the volunteer in different areas. So that collaboration is that is huge.
And even when we're talking about grant funding now, you can't write a grant unless you're collaborating with folks. And those collaboration pieces are important because those collaboration pieces let funders know that you're actually working together with the organizations that are in your community.
Not just try to get a pot of money over here to try to advance, your personal cause. It's really about the cause. And you do need other resources sometimes to get the impact and the penetration into the community that you really need.
And the bigger cause is the community. How do we make a difference to the people outside of our walls?
Right. It's not about one organization or, my, group. So I love that collaboration piece there. So we'll make definitely some headway in the health and wellness in our minority communities. All right, Yvonka, is there anything else that you want to share with us today?
I think we said it all.
We pretty much said it all. And I'm glad that you were able to be on the show. It was a last minute call, and you came through, and I really appreciate that. I can remember meeting you some of the days back when you were at the American Heart Association, and we had the lunches, and was able to participate in that. And I'm glad to be a volunteer. And anytime you can call on me, I'm available. I'm glad to be able to help you out with any services or programs that you have going on.
Thank you.
Okay, so ladies and gentlemen, that's all we have today with Yvonka Hall. So remember to please check out the websites down. We have them listed, and we'll have them all lined up for you again at the end of the show as we roll the credits. So you'll be able to participate in all these activities coming up. Please tell your family and your friends. And if you have your own groups, just want to have you to come together and to be able to participate in a great way. And if you can volunteer, that would be awesome.
Go beyond, beyond, beyond. The world, it's a brand new day. Turn it up, up, up. Let the music play. Let's go. Your stars too bright that you can't catch the light. This is your day to shine. Your time to win. So raise your cup and drink it in. Why do the same when you can go beyond, beyond?
Also, remember, what can you do today to have an impact for tomorrow? So as we look back at our history from today in the 21st century, these beginning days here and years, what impact can you make on your communities? People will remember you and not remember to the shoulders that we stood on to get there, making that way to be able to get our education and to have resources and to be able to get into some other activities where we would not have been able to. So let's take advantage of those resources and make something happen positive in our neighborhood.